Hello, and welcome to InjuryDoctorHelp.com. This presentation answers the question how Iowa attorneys can get the most out of the A.M.A guides and fix broken cases. Today we are going to be discussing the A.M.A guides to the evaluation of impairment and how the guides relate to broken legal case files. So, what are the A.M.A guides? The A.M.A guides were created to standardize a rating system which describes the amount of damage caused by injuries. The guides pertain to workers' compensation and injury compensation. We are directing our attention to the A.M.A guides 5th edition and injuries related to motor vehicle accidents. So what is a broken case? Injury documentation that is incomplete or lacks the essential medical documentation. This may include an incomplete diagnosis, and unmatched legal demands. Insurance company settlement offers often reflect this incomplete documentation. So offers may be half the value of all the medical bills incurred, excluding legal costs and pain and suffering. Why do we use the 5th edition? Well, more legal precedence has been established with the 5th edition. Also, Iowa recognizes the 5th edition as well. There are only minor differences between the 5th and 6th edition guides. The impairment results obtained are the same, with only minor differences in how those results are calculated. Individual states may differ as to which guides they follow. It is important to report which guides are being used in the documentation. For attorneys listening, you can evaluate your own case files. Throughout this presentation, we ask a series of important broken case questions. If you answer no to any of these questions, your case may be broken. If it is broken, we are here to help you make improvements. Important broken case question number 1. Does your case contain specific references to which A.M.A guides volume is used in the injury documentation? If no guides volume is referenced, then it is likely the A.M.A guides were not used at all. Make sure your documentation references the correct guides for your state. Iowa recognizes the 5th edition of the A.M.A guides. Question: what are the common mistakes attorneys make related to using the A.M.A guides? Attorneys often rely on doctors who do not fully understand the A.M.A guides. For example, if a patient has a 25% whole person impairment rating, the insurance company may still want to have an MRI to diagnose the herniated disc. They may not fully understand that alteration of motion segment integrity is actually rated higher than the MRI in the A.M.A guides. Important broken case question number 2. Trained injury professionals are able to evaluate medical notes from a motor vehicle accident and perform an impairment rating. Having the impairment rating included in the injury documentation is critical to avoid a broken case. Keep in mind, impairment ratings account for 25% of the entire case value. Does your case contain an impairment rating? What is an impairment? The A.M.A Guides 5th edition defines impairment as, and I quote, a loss or loss of use or derangement of any body part, organ system, or organ function, end quote. Impairments that are to be rated are permanent impairments. What is an impairment rating? And this once again comes from the A.M.A guides, and I quote, impairment percentages or ratings developed by medical specialists are consensus-derived estimates that reflect the severity of the medical condition and the degree to which the impairment decreases an individual's ability to perform common activities of daily living. Important broken case question number 3. Does your broken case include the terms loss of enjoyment or duties under duress and exclude the term activities of daily living? ADL, or activities of daily living terminology, in the documentation does not meet insurance company requirements. Instead, documentation should include the terms loss of enjoyment and duties under duress to meet insurance company requirements. This is where the guides differ from the insurance company requirements. Insurance company adjusters and the software they use do not typically acknowledge the term activities of daily living. Instead, They prefer the term duties under duress and loss of enjoyment to describe how injuries affect a person's lifestyle. DUD, as it's abbreviated, or LOE, as it's also abbreviated for loss of enjoyment, account for 50% of a case value, and impairment ratings account for an additional 25%. So between the duties under duress and the loss of enjoyment and the impairment ratings, that's 75% of a case value. How is an impairment determined? Impairments of related body areas are established from the medical-related testing performed by injury care professionals. The A.M.A. guides determines which tests are to be used and under what circumstances. Testing includes X-ray studies, MRIs, computerized motion assessment, and other tests used to determine how severe the injuries are in the motor vehicle accident. The testing we use to diagnose patients involved in motor vehicle accidents is determined by the A.M.A. guides. What is a permanent impairment? A permanent impairment is defined as one that has reached maximum medical improvement. The injured person is considered stable and their condition is unlikely to change in the next year with or without treatment. Their condition is classified as static and stable and is not expected to change more than 3%. So who determines how the impairment affects disability? Well, attorneys, judges, and courts determine how an impairment affects disability and a disability rating, and how it is then translated into a monetary value. I want to make a note. Doctors perform tests related to impairment. Any trained injury professional can calculate an impairment rating. The legal system determines how this impairment affects disability, but some doctors with training can determine disability too. Just to be clear, we are not trained to determine disability, we are trained to determine impairment. Our goal is to help attorneys determine if their case includes complete and accurate impairments. Impairments are determined through testing. Medical testing objectively determines the amount of impairment a person is suffering with. Here we show electronic muscle testing, monofilament sensory testing, and range of motion functional joint testing. All three of these testings we do perform in our office. How does impairment differ from disability? Distinguishing the difference between impairment and disability is imperative. One individual can be impaired significantly and have no disability, while another person can be quite disabled and have only limited impairment. Disability typically refers to one's ability to perform duties and earn an income. For example, a person with paraplegia who is wheelchair-bound may be working full-time successfully as an accountant. However, a concert pianist might have a missing finger that severely limits his ability to perform. Today we are talking specifically about impairments related to motor vehicle accidents. We are not talking about impairments related to illnesses or non-motor vehicle accident type injuries. How does the A.M.A. guides rate auto injuries? We use the diagnostic related estimate models to rate the injuries related specifically to motor vehicle accidents. We do not use the A.M.A. guides range of motion model to determine impairment with a motor vehicle accident. Range of motion models are used if the mechanism of injury is unknown. In this case, we know the mechanism of injury, it was a motor vehicle accident, which is why the guides require a diagnostic related estimate in that case. In a motor vehicle accident, the head and spinal column are the most commonly injured body parts. The A.M.A. guides say to use specific diagnostic related estimate models to determine head and spine injuries. DREs, as they are abbreviated, are the most commonly used way to rate the spine of an injured person. What are the diagnostic related estimates, also known as the DREs? According to the A.M.A. guides, they refer to a specific rateable condition. DRE models contain the process by which we rate an injury for impairment. DREs are based only on objective findings. This system excludes aging, degenerative disease, or stated limitations. Each DRE grouping has a range of about 3%. Examiners are expected to estimate the level of impairment within a 3% range. This is clearly explained in the A.M.A guides. DREs consider each of the three regions of the spine, the cervical, the thoracic, and the lumbar spine, separately. If more than one level is rated, the ratings are estimated separately and combined using the multiple impairment tables included in the guides. It is important you understand that DREs and impairments contain some level of subjectivity. But what happens if two or more different medical opinions exist? The injury professional who more closely adheres to the A.M.A guides will win the greater weight challenge in court. In other words, the provider who more closely follows the guides will better minimize any subjectivity. Important broken case question number 4. Does your case contain table numbers and specific page numbers as references from the A.M.A guides? By citing the guides, injury care providers are able to demonstrate their adherence to the impairment rating protocols. In our office, we perform the following special tests for the spine because the A.M.A guides require it: computerized radiographic measurement analysis, monofilament sensory testing, correlated muscle testing, and deep tendon reflex testing. We also cite the pages of the A.M.A guides and how the injuries relate. Important broken case question number 5. Does your case contain medical documentation with the results of the CRMA, monofilament, muscle, and deep tendon reflex test? Are the test results clearly described? It's a good time to mention here, we are not attorneys and we are not offering legal advice. Instead, we are offering professional evaluation and support of proper medical injury documentation. We are here to help assist you with your broken case files. So, a legal strategy. If you are an attorney in court or settlement negotiation and facing an expert witness or independent medical examination finding, always consider if the expert has performed all of the proper diagnostic tests. Did they perform the test to the standards the A.M.A guides require? In our experience, many I.M.E. or independent medical examining doctors will not order a ligament study or use monofilament testing. Prior to sending in your demand, you want to consider what tests were performed. What should an attorney look for in the way of accurate testing? An attorney should consider if a medical validation has been performed to evaluate the performance of the above test. A medical validation determines if the testing closely adheres to the A.M.A guides and requirements. Medical validation is performed by an objective third-party medical professional. Does your case contain validated medical documentation? Validated medical records are critical to substantiate the diagnostic test performed. Reach out to Dr. Tim Redenbaugh if your cases do not have any of the above tests clearly outlined in the medical notes, as well as a medical validation. It is never too late to fix this discrepancy unless, of course, the case has been settled. What are the examiner's roles and responsibilities? This answer comes directly from the A.M.A guides, and I quote, "The physician's role in performing an impairment evaluation is to provide an independent, unbiased assessment of the individual's medical condition, including its effect on function, and identify abilities and limitations to performing activities of daily living." It is important that this paragraph be included in the injury documentation. There are 6 broken case questions. If you answer no to any of them, then your case may be broken. If you think this is possible, reach out to Dr. Tim Redenbaugh and we can discuss this matter further. Question number 1. Does your case contain specific references to which edition of the A.M.A guides are used? Broken cases contain no reference to which edition of the A.M.A guides are followed. This is usually a sign no guidelines were used or the guides were followed loosely. Does your case contain an impairment rating? Broken cases have no impairment rating. If the medical providers did not perform an impairment, this is often reflected in the insurance company's settlement offer. Does your case contain details related to loss of enjoyment and duties under duress, and avoid the terminology activities of daily living? Broken cases have no mention of DUD or LOE. Insurance companies consider duties under duress and loss of enjoyment to be half the value of an injury demand documentation. If these items are missing, a case is significantly devalued. Does your case contain specific references to which tables and pages from the A.M.A guides are used? Broken cases contain no clearly defined table and page numbers that were used from the A.M.A guides during the impairment rating process. Does your case contain computerized radiographic measurement analysis testing, monofilament sensory testing, related muscle testing, and deep tendon reflex testing results? Broken cases have incomplete diagnostic testing. This leads to missing diagnoses in the demand letter. Missing diagnoses means the value of the case is reduced. A broken case has poor or no clear documentation of injuries. It is essential to have an independent validation performed on the medical records to confirm the A.M.A guides were followed. This also validates the essential tests were performed to document the injuries. So, does your case have validated medical documentation? Why are we here? Well, we are here to help attorneys with their broken cases. We can evaluate the case and make suggestions to improve the accuracy of the injury documentation. Once again, we are not attorneys. We are not here to offer legal advice. We're here merely as a sounding board to assess the injury documentation presented. If you are an Iowa attorney with additional questions, contact Dr. Tim Redenbaugh at 712-732-3349 or email at stormlakedc@gmail.com. There is no charge for the initial phone consultation. Thank you, and we hope to hear from you soon.